My name is Dr. Ivo Ferreira, and I want to thank you about being part of this community. From now on, I'm going to have the role of the mentor. I want to be there for you in every step of the way. This is going to be a never-ending journey in which you need to improve little by little, and to have a mentor next to you is going to change that path completely. It's very important that by being part of this community, we can help you in every step of the way. What we want is, the first thing is to have an online platform in which we're going to give you a lot of fundamentals and a lot of practical knowledge for you to make decisions, not only in the beginning, but also in the future, to implement new technology or to have new techniques or many things that we can learn and gonna appear in the future. The second thing in which we believe is a simulation activity, a simulation experience in which there's many things that are gonna change. Especially, we're gonna redefine failure. So you're gonna be in a safety zone in order to learn and to do mistakes and to learn from them and to repeat task many things. And in the end, and this is extremely important, we believe that you need to control what's going to happen in your first surgical cases. In order to do that, this is not like, okay, I'm going to, find a place and I'm going to do 30, 40, 50 cases. No, what we need to do is to plan for that. We need to have a mentor next to you. You need to be guided, but most of all, you need to feel safe. You need to feel that if everything happens, you're going to have somebody next to you. What we're going to do during this entire experience is to do a lot of analogies of what happens in an airplane industry. Let's grab the example of Emirates. Emirates is very rigorous in how to, choose pilots and how to train them. But that training is not that you trained 5 years ago and now you're ready. No. Completely the opposite. You have certain skills, then they train you in specific things, then you go to simulation, then you get to be a co-pilot, then you have flying hours, then you get to recertificate yourself again, you go back to the simulator, and then little by little, you start doing surgery on your own. Guess what? We can do that now, okay? Now we have the technology and the way of how to do it. What we want is, it doesn't matter in which stage you are, we're gonna offer you something. We're gonna individualize your case, and we're gonna give you exactly what you need in order to get to an objective that we know. That objective looks like this: become a microsurgeon, then be ready for the operating room, then be competent, and always then try to aim for mastery or excellence, okay? In order to do that, we need to understand what it means. We need to understand that objective. For being a microsurgeon, you need to manage the microscope. You need to see in 3D. You need to manage your 2 hands, your 2 feet, and you need to, with an instrument in your hands, go through a small incision, navigate in the anterior chamber, and then perform tasks with a centered eye. That's not easy. Then, to be ready for the operating room, you need to know your Phaco machine, as an airplane pilot knows their Phaco machine. Sorry, an airplane pilot knows the airplane. You as a surgeon know the Phaco machine, okay? Very important. Then you need to know the microscope. You need to know the 2 foot pedals, position 1, 2, and 3. You need to know your instruments. You need to know many things, but especially, you need to know that the operating room is a special place to perform. It's not a place to learn, it's a place to perform. And to perform, you need to get ready with the correct nutrition and the correct mindset. And we're going to talk about that a lot. In our programs, we have a psychologist and we have a nutritionist. Why? Because they're very important. And also you have the mentor, the surgeon who went through that. Okay? By doing that, you're gonna go to be competent. To be competent, you need to first say, okay, I want to be competent to do surgery with somebody next to me. Then I want to be competent to be by myself. Then I want to be competent to be in a public healthcare system. Then I want to be competent to be in a private practice. And why not to be in a small city with no retinologist close to me? Those things are completely different, and we're going to help you in every step of the way. How we're going to do that? We're going to do this. We're going to have the best mentors. We're going to have the best technology. We're going to have VR simulation and an operating room setting with artificial eyes. And we're going to have the best mentors. Mentors, technology, and methodology. Okay? How an adult learns, but also how that mentor is not only a good surgeon, but is a good trainer, a good coach to you. That's the special secrets. That's the key for you to do what we call the wormhole. The wormhole is an astrophysics concept that you can hack time. That's exactly what we want. You know, now probably you have this status quo in your mind that you say, oh, I need to do residency. This is going to take years. And, you know, it's going to take a long time and a lot of frustration. Well, guess what? Now we have a new way how to do it. How? We're going to, again, online, give you a lot of theoretical knowledge. In a simulation course of 2 weeks, you're going to have to completely transform. Imagine like in the Matrix when Neo gets connected. Well, that's what's going to happen to you. And then you go to the operating room with a progression kit that it's a bionicle kit that you can put in the operating room and train, and also a micro-rec in order for us to give you feedback when you're training and why not in your first surgeries if you need that. Also, with the micro-rec, you can record your surgeries, send us those surgeries, and by sending us, we're going to give you feedback. Okay? When you understand that, you're going to understand that one of our other secrets is how we're going to train you, or how we're going to approach that training for you. We're going to train you in the psychomotor skills, you know, as a fine motor skills with 2 hands and 2 feet synchronization. Then we're going to train you in your cognitive skills. Cognitive skills are how you process information, how you take decisions and solve problems. Decision making and problem solving. This is the most important thing. But most of all, to understand that the cognitive aspect is how you process information. Okay? What is expertise? Expertise is pattern recognition. So guess what? That's what is going to be one of the keys, because we're going to put everything that into your brain long term in a very efficient way in a shorter time. You don't learn that in the operating room. You learn that in a simulated environment in which you can see failure and you can learn from failure. Okay? We're going to talk a lot about this, what the simulated environment is going to give you. Then the mindset skills. Probably one of the most important elements of our course is about how you train yourself to have the correct mindset to perform, but also, you know, to understand that you are a surgeon and you are a human being and you need to connect those two. I think it's very important then that you compare what is the status quo and that mindset that you say, oh, I want to go to the operating room, I want to go to India to do 50 cases, or Egypt, or this or that, versus do an individualized plan with the best technology and everything that is completely designed for you to learn fast, easy, with safety for patients, but to understand what you're doing and to learn long term. What you learn with us is to learn how to think. In order to do that, we're going to compare the status quo versus simulation. In status quo means that you learn, you do some wet labs, some this or that, and then suddenly you go to the operating room, you're high stress, you're not open to learn, you want a good outcome for the patient. Okay? In a simulated environment, completely the opposite. You're learning, how to think, different scenarios, with repeatability, with objective feedback, and with the capacity to connect with a mentor and do the task and understand why you do. In the operating room, you copy. In the simulated environment, you learn how to think. Again, very important to understand that then you need to jump into the operating room. We have that covered, and we have that specifically individualized for you. To finish, and this is very important, we're going to tell you about 2 examples. We're going to talk about capsular rhexis. We're going to talk about Phaco. Okay, in capsular rhexis, it's important you're going to understand first how to do things right. Second, how to adapt to complexity. Let's say a plaque in the anterior capsule or high tension capsular rhexis. In Phaco, you also need to learn how to think, and you're going to face hard cataracts, soft cataracts, sonnular weakness, small capsular rhexis, hydrodissection that wasn't performed perfectly, sonnular dialysis too. So guess what? By facing different scenarios, you're going to learn how to think. But the most important thing also is we're going to share with you testimonials, because you need to understand what other people think. One of the testimonials I like is about Maria from Poland. She was telling us that, she came here, she trained, she went back, she was doing surgery. And let's say after 2 months of doing surgery, she finally understood what happened to her. This is not easy. We tend to think that we learn in the operating room. We tend to think that simulation, could be good, but we don't understand the true value of a simulated environment. So that's very important for you to understand. Other testimonials which are important is if people they know that they're going to have high volume of surgery, but they do simulation anyways. Why? This is Joao from Portugal. Joao, his dad, is an airplane pilot. He is overseeing all the pilots in his company. So he was telling his son, you learn in a simulated environment. You need to go to the simulator. And he will say, well, Dad, but I'm going to have high volume. Yeah, but you're going to have high volume in the operating room. And that's not the place to learn. That's the place to perform. Okay? So we're going to tell you about these 2 examples for you to understand what can happen to you in a simulated environment. Again, we're here for you. We are here to companion you during your journey as I become an excellent surgeon. We don't want to sell you a course. This is not important for us. We want you to be part of this community. We want you to grow and have the chance we didn't have. We trained 10 to 12 years ago, and we only had one chance to learn in an operating room. It was very frustrating. It took a lot of time, okay? And also, in the end, we weren't as good as we could, because one of the things you can train too is complications. You can train anterior vitrectomy. You can train how to rescue a capsular rhexis. You can train how to put a CTR when you have a sonnular weakness. You can train on how to do a capsular rhexis in a weak sonnula. So in the end, I hope you are part of this community, that you talk to us, that we can have a dialogue back and forth, and you plan. It doesn't matter in the stage you are, you plan to simulate this and to learn in a simulated environment and to go back to simulation in order to get good and competent every time. Thank you. I want to do a workshop for you to understand the power of mentorship, the power of a simulated environment, and the power of having the correct methodology, how to learn something, not only long-term, but how to learn from fundamentals to how to think. Because that's exactly what I want from you. I want you not to copy a technique from your mentors, but I want to learn how to think. You learn how to think and how to adapt in a regular case to have reliability, but you need to manage complexity and you need to manage complications. And that's exactly what we're going to do here. Think about it. We're going to go for what the objective of capsulorhexis is, because capsulorhexis has a clear objective. I want the correct size, the correct shape, that it's circular, and that it's centered. And in order to do that, I'm going to adapt for that. The thing here is that this is a complex environment in which it's going to be important even the type of viscoelastic you use, the amount of viscoelastic, the elasticity of that capsule, the state of the sonula, and how much tension does it have. If the patient has something in the vitreous that is pulling up too, and also the pressure inside that bag. Every single little element of this is going to have an impact in your decision making. So for the fundamentals, you need to know how to create a flap, and then which vectors are you going to use. We call it the sharing technique and the ripping technique. And guess what? You're going to be a decision maker on steroids to go to the objective and create an objective that it's, with the correct size, with the correct shape, and everything we talked about. But in order to do that, you need to make the correct decisions. You can do that in a simulated environment, and you can do it that many times with good outcomes and good feedback. Also, we're going to talk about complexity. We're going to talk about what happens when you have high tension, when you have high elasticity of the capsule, what happens in a white cataract when you have high pressure from the intracapsular bag. And of course, when you have plaques, either you have uveitis or trauma, those plaques in the anterior capsule are going to completely change the way you make decisions. Extremely powerful. Then we're going to tell you about how to rescue a capsulorhexis that you lost under the iris. We're going to talk about the little maneuver. We're going to talk about the EVO ripping maneuver, how to rescue a capsulorhexis. And again, this is not easy to train in an operating room environment. The perfect place to train this is a simulated environment. And the end, we have even better things, is special scenarios. We're going to tell you how to make decisions when you need to do a posterior primary capsulorhexis. Completely different structure that you need to manage, completely different. Now I'm going to show you something completely amazing. We're going to grab a capsulorhexis, and you're completely going to understand the power of simulation, the power from a simulated environment on how we can change scenarios so you learn how to think, and a mentor sitting next to you. Why? Because look at the scenario I'm going to show you. You're going to have a complete surgical step, a full surgical step. We can deconstruct that surgical step in many different things. You can have an enlargement training of the capsulorhexis. You can face a capsulorhexis with a plaque and also with leukocyte cortex. But most of all, you can have a rescue maneuver. So let's start from the beginning. Let's understand how you do and how you perform a capsulorhexis by having a guiding element, put viscoelastic already, have changed the capsular tension, okay, and change the hardness of the cataract. These are very important things. Also, you can have cellular weakness. You can stain or not the capsule to see it correctly, and this is what you're gonna see when you do a surgical step like this. This is how powerful it is with that anterior chamber. Now you can see it, that is full of viscoelastic. But let's do something again. Let's remove the viscoelastic from the anterior chamber. Okay. So you can see how that capsule, look at that, is completely flat. Okay. We're talking about the superior right event, but also we can put a guiding element on the capsule. Okay, that is going to guide you with your first concepts. Okay, so now we're going to see the capsulorhexis, and you can train with a small cystotome. Okay, you're going to come here and you're going to do the first flap. And also, you're gonna try to make that flap parallel to the iris, like this, okay? Good, now it's getting too big, but the cool, important thing here is you're gonna train yourself on how to do shearing and ripping technique. This is something very important that you need to train. I'm doing ripping technique, as you can see. I'm pulling to the center of the eye, and I'm controlling the flap. And now I'm folding that flap. I'm doing shearing technique. Look at this, shearing technique. Put it vertical. This is shearing, and this is ripping. You see, I'm pulling to the center. What you want is a perfect objective here. Fold it, shearing, ripping. Shearing, ripping. If it's too big, I do ripping. You see, that's too periphery. I go ripping, ripping, ripping. Again, what I'm doing, look at the anterior chamber. I'm losing viscoelastic. That is why that flap is going to the periphery, okay? So that's very important also to understand. Look, I'm gonna put more viscoelastic in that anterior chamber. You see the side view? Now it's getting much better. This is very, very important for you to understand. If you're moving through that incision, now I'm gonna do ripping technique, ripping, and then shearing. Okay, I wanted that capsular rhexis to be round. There's so many things that you can, simulate. Look at that, perfect, there you go, okay? Very important to understand, but then we're gonna do something different. Look, I can put in the screen, I can put a plaque in the anterior capsule that is gonna look like this. That plaque can be medium or large. Look at that. Imagine how it is to face a case like this, okay? It's important to understand perfectly what is happening here. Then, let's go for something which is completely amazing, and we're gonna show right here. It's gonna be a rescue maneuver, okay? So as you can see in this scenario, the rhexis is going to the periphery, but we cannot actually put it more periphery. Look at this. We're almost done with the capsular rhexis, and now we can go to 5. Look, you cannot see what the cord is doing. So what you need to go is you need to face this kind of case as a rescue maneuver. There's 2 rescue maneuvers, and you should be very careful. Look at this. And you have the vector going to the periphery. You're gonna grab it, and look at this. I'm gonna pull to the center of the eye. Did you see that? That was a ripping, that it was controlled. And I pulled to the center of the eye, and I was able to rescue that. We call that the EVO ripping technique. Okay, you can finish it here. Look how it tends to run out. Another rescue maneuver that you can repeat, let's do the same thing, is called the little maneuver. In the little maneuver, what you want is the rhexis to be at the same plane as the other one, and pull in the opposite direction. Grab it and pull in the opposite direction. You see that? That's another way how to rescue the capsular rhexis. And in the end, one of the great things about doing simulation is what you're gonna see here. Look at this. This is what we call a primary posterior capsular rhexis. Repeat. Primary posterior capsular rhexis. So I need to go to the posterior rhexis. I'm going to put a lot of viscoelastic here. And I'm going to do a small flap in the posterior capsular rhexis. You see, like I did now. And then I'm going to create a vector here. And again, all the forces that I'm going to implement here are going to be completely different and completely new. Keep going. I need to go very deep. Okay, I have a cord hole, and now I'm going to go with the forceps Let's put the forceps. And with the forceps, I'm going to be very careful on how I apply those vectors. And mostly I'm going to do reaping. With this reaping technique, reaping. Good. I need to control the size. Reaping. It's coming great. Reaping. Look at that. You need to control the size and the shape. You see how I control the vector, sharing and reaping, being with a lot of confidence. And look at that posterior capsular rhexis is going to be perfect. This is something you do when you have something that is not correct in the anterior capsule, or if you do pediatric cataract, in which you don't want that posterior capsule to get opaque. In some of those cases, you can also do an anterior vitrectomy. So again, I think we made our point. Simulation is going to teach you the fundamentals. It's going to put you different scenarios so you can make decisions in dynamic environments, high tension, low tension, white cataract, plaque. Then you go to complex cases, again, like we said, with plaques and with other behaviors of the capsule, but then you go to complications. You go to a rescue maneuver, and most of all, you go to things that you don't do frequently, like what? Like a posterior capsular rhexis. Thank you.